Hi, welcome to this gentle yoga for back care practice. Before we begin, I would suggest grabbing a few towels. If you have some pillows, that would be great to have handy. And also if you have any yoga blocks, or I have some extra mats. I don't have any yoga blocks at the moment, but I will. To begin, we're going to start in what's called Sukhasana, or easy seated pose. And we're going to start with this posture to help us tune in, to check in. But if you are already sitting in this posture and beginning to feel uncomfortable right away, please feel free to start the practice in Shavasana, which is lying down, or grab one of your pillows or your towels and sit on it. Sit just kind of at the edge of the pillow, and that should help you be more comfortable. Please take a moment to find the best posture that suits you today. Once you've found that posture, I invite you to close your eyes and begin to tune into your body. I like to take these first few moments of our practice to make the transition from the external world to the internal world, to our inner being. With your eyes closed, begin to observe the flow of your breath. Don't attempt to change the breath at all. Just simply observe. Imagine you can see the breath as it enters in through your nostrils, travels down all the way to your belly, to the diaphragm. And then when you exhale, imagine again seeing the breath leaving your body. Feel your shoulders relaxing away from your ears. Feel the crown of your head reaching for the ceiling, for the sky. Now begin to observe what's happening at your spine. If you can visualize your spine, every time you inhale, feel the lengthening happening in your spine. And as you exhale, the releasing and the relaxing back. Your spine coming back closer together. So simply with the breath, we can nourish the spine. Inhaling, lengthening, exhaling, relaxing, and releasing. On your next inhale, begin to blink your eyes open. Our next posture is simply going to be some side bending. The point of these first few moments of this practice, especially since it's a back care practice, is to actually get the spine moving in its natural directions. And with this next posture, we're going to start moving it laterally, doing some side bending. So bring your arms down to your side, once again releasing the shoulders, relaxing your shoulders. Every time you inhale, imagine the lengthening happening in your spine and the crown of the head reaching up towards the ceiling. So inhale and lengthen, And then exhale and go bend over to the right. And it doesn't matter how far you bend over. Inhale, come back to the center. Exhale and laterally bend over to the left. And continue to move this dynamic movement, side lateral bending. But every time you come to the side, please make sure that your hips stay rooted into the floor. Also make sure that you truly are moving side to side like a pendulum, not bending forward, and also making sure that you're not bending backwards. So like a pendulum, moving side to side. Inhale every time you are coming back upright, and exhale every time you laterally bend. An option would be to bring the arm up as you come to the side. Inhale, connecting the movement with your breath, and exhale. One more time on each side. And now we're going to hold on to the right side for at least 3 full cycles of breath. Now I have my arm over my head. You might find this uncomfortable. Try perhaps bringing the hand behind your head, or even at your thigh or down by your side. And if you're wondering what do you do with your neck, your head, you can look down, look straight ahead. You can look up. Inhale, come back upright. Exhale, let's go to the left. And take those few seconds in the posture to decide what you would like to do with your head. And then once you've found that sweet spot, hold. Focus back on your breath. Inhale, come back up to the center. Exhale, and just pause. Close your eyes. Take notice of how you feel just at this very few moments of the practice. Moving on to our next posture, we're going to actually start to bring the movement of twisting to our back. So let's again, before I forget, if you have the ankles crossed or one on top of each other, you might start to feel uncomfortable in this particular pose, so feel free to switch up. So I have now placed the opposite leg in front. Bringing the arms back to your side, notice how I'm trying to relax through my shoulders, and my fingertips are just lightly touching on the floor, but I'm still thinking about lengthening up through the crown of my head. Take a deep breath. Inhale. As you exhale, twist over to your right. Inhale back to the center. Exhale, twist over to your left. Continue this dynamic movement, connecting the movement and the breath. Focus on the twist coming from the belly button upwards. So the hips stay rooted, pelvis stays neutral. Don't over twist. And what I mean by that is if you are trying to over twist, you might find that your hip starts to lift or you start to round through your back. Remember, it's not about how far you can twist. It's more about, are you maintaining the length of your spine? And are you staying rooted as you continue to twist? On the right side, let's stay for at least 3 cycles of breath. To deepen into the twist, if it's available to you, you can take your left hand, place it to the outside of your thigh, and press into it as it helps you to lift and twist deeper. Inhale and begin to untwist. Exhale, twist to your left side. You could also take the pillow or the block, place it behind you. Place your left hand behind you, the right hand at the top of the thigh, and use, again, that leverage to help you twist deeper. But please try to keep your spine long. If you are in any way rounding forward, you've gone too deep. So please just come back to a point that you can maintain that long spine, and then you can deepen into that twist. Untwist with your inhale. Exhale and allow your body to just take a moment to absorb what we just did. Coming now to all fours into a tabletop posture. Take a moment to check and align your knees directly underneath your hips, hip width apart. Your hands and your arms, align the creases of your wrist to the short edge of the mat. And it's okay if you want your arms to be slightly forward of your shoulder, that's fine. But if you also feel more comfortable with the wrist directly beneath the shoulder, that's great also. Take a moment, as always, to find the posture that feels best for you. We're going to move through spinal flexion and extension with a cat-cow. As you inhale, you're going to allow your belly to melt towards the floor as you arch your back and look up. As you exhale, push into the floor. Blow all the air out as you bring your belly button towards your spine and allow your head and neck to relax. Moving with the breath, inhale, coming into the cow posture. Exhale, moving into cat. I also like to sometimes add some movement through my ankles. So as I inhale, my toes are untucked. As I exhale, I slide and tuck my toes. And I often like to move into just a quick little child's pose. Inhale, I come back up and I move into cow as I untuck my toes. And exhale, coming into cat, and a little bit of a child's pose, just to complete my exhalation. One more time, inhale, cat, exhale. Coming back to a neutral posture, to tabletop, where your back is neither arched nor rounded. Lengthening through the spine, visualizing this time that the crown of your head is reaching towards the wall in front of you, and your tailbone is reaching towards the wall behind you. Pushing into the floor as you lift. So think about what's happening at the shoulder blades. You don't want to sink through. Lift away. Imagine you are a table, thus the name tabletop, where your back is flat. GoPro stopped recording. From tabletop, we're going to move into what's called pointing dog, going to help us with our core engagement. From tabletop, bring your right leg back, so straighten through the knee. but keep the toes on the floor. And take a notice of most especially your back, trying to make sure that you haven't collapsed, that there's no arch in the back. So tuck the pelvis, engage your abdominal muscles, flatten your back. If you're finding that this is super easy, lift the leg, keeping that leg parallel to the floor. Might be hard to actually know that it is parallel to the floor if you don't have a mirror. I don't practice with a mirror. But one thing that might help is if you lift the leg too high, the tendency is to arch through your back. And so then just try to bring that leg down to a point that you feel you are still maintaining a flat back. If this is too easy, bring the left arm out in front of you with the fingertips just resting on the floor, or even another level up would be to bring that left arm up by your ear. Keeping those hips parallel to the floor. Take another deep breath, try to reach and extend a little further. Exhale, bring the hand and the knee down. Moving on to the second side, take the left leg back, straighten the leg, toes on the floor. The crown of your head continuing to reach towards the wall in front of you. Your tailbone reaching to the wall behind you. Option to lift that leg, once again being mindful of what's happening at your lower back. Taking the right arm out in front of you, either leaving the fingertips on the floor or bringing the arm up by your ear, continuing to stretch and reach, a very active pose. Imagine squeezing the bones with your muscles. Don't forget your breath. Take another deep breath. Inhale, see if you can reach a little further. Exhale, bring the hand down, bring the knee down, and just sit on your heels for a moment. Once again, I invite you to close your eyes and pause. Now I invite you to come lying down onto your belly. We're going to start with some dynamic cobra pose. Placing the hands right near your chest. Looking down instead of looking up. You may have to, of course, look up to see what I'm doing, but then once you've been able to see and determine what I'm doing, bring your head back down so that the back of your neck stays long. Inhale. You can push into your hands a little bit as you bring that chest up away from the floor. Exhale and lower. Inhale, lift. Exhale, lower. Instead of trying to push through the hands, see if you can lift using the muscles of your back. One more time. Inhale and lift. Exhale and lower all the way down so that your forehead can touch the floor. Bring your arms back by your side with the palms facing down. Inhale, lift the chest. Exhale, lower. Now this is dynamic locust pose, Shalabhasana. But if this is too difficult for you, you don't like it at all, come back to Cobra, bringing your hands by your side, up here by your chest. This last one, let's try to hold it up for 3 cycles of breath. Either the hands and arms by your side or up by your chest. Once you've completed your cycles of breath, release and press yourself up to a child's pose. I would suggest you bring the knees together for this child's pose and maybe even stack your palms and rest your forehead on your palms. Or, if that's not comfortable, take the pillow. Place it underneath your forehead. Resting just for a breath or two in child's pose. On the next inhale, push yourself back up, coming to a seated posture and moving into a bridge pose. Lying on your back, bending the knees. Take a look, try to align the knees with your hip bones. Not the fleshy part of the hips, but right here at the hip bones. Bring your heels in so that they just touch your middle finger. That is a good place to start to know how far to bring your feet in. If your feet are too far out and you come into the bridge, you're out of alignment. And also, you don't want them too far in so that when you lift up into bridge, your knees go way past your ankles. The goal is that when you lift your hips, your knees are over your ankles. And again, I know it's not easy to know what that's like if you don't have a mirror, but it's a wonderful way to begin to actually just be in tune with our bodies instead of relying on a mirror. But if you have a mirror, that's great. If somebody's around you that can tell you, even better. Inhale, lift the hips up. Exhale, slowly lower, one vertebra at a time. Inhale, lift up. Exhale, lower, one vertebra at a time. On this next posture, we're going to move into a supported bridge, and I'm going to take my pillow. This is a great time for you to take either your blocks or your towels. Lift your hips up and place the prop underneath your pelvis, not up at your lower back, please. You don't want it up at the lower back. You want it over at the pelvis, right above your sacrum, that flat bony part above your tailbone. And this is a supported bridge. Relax your shoulders, relax your head. Just try to relax something. Close your eyes and take some deep, nourishing breaths. A supported bridge pose. You might find that you don't really feel anything happening in your back, and that's great, or you might want to go deeper into the posture, so just continue to grab some towels, some more pillows, to elevate your hips a little bit more. On the next inhale, lift your hips back up. Remove the props from underneath you. Put them to the side. Gently lower the hips one vertebra at a time back to the floor. Don't rush into trying to bring those knees right away into the chest. Just let your hips melt into the floor. Let your spine find its normal posture, alignment. Now let's go ahead. Grab both knees, hug them into the chest. Keep the right knee into the chest as you straighten that left leg along the floor. Bring your right arm out to the side in line with your shoulder, and bring your right knee across your body to the left as you look over your right shoulder. Try to keep the shoulder down on the floor. It's not about how low are you able to bring this knee It's about, are you able to keep the shoulder down on the floor? Sometimes we want to sacrifice this movement, this posture, by thinking you've got to take this knee down, so you twist like this and notice how I'm up off the floor. So that's not our goal. Keep the shoulder down and then twist. Inhale, come back to center. Bring the left knee into the chest. Straighten the right leg. Bring the left arm out to your side in line with the shoulder, and bring the knee across the body. Once again, notice how far away from the floor my knee is. If I was trying to bring this knee down, I would not be able to keep my shoulder on the floor. You're looking over your left shoulder, but if that is not comfortable, feel free to look up or even look over the right shoulder. Inhale, come back to the center. Bring both knees back into the chest and hug it really tight as you can. Also, you might want to hug, wrap your hands, your arms around your knees, clasp the opposite elbows. Try to bring your nose to your knees as tight as you can. And then release. And moving into our final posture for the day, Shavasana. My favorite posture for the day, of all time actually, Shavasana. In Shavasana, allow your legs, your feet to just simply roll out and bring your arms a little further away from your body. If you're starting to feel some tension, discomfort in your lower back, you have a couple options, more than a couple, but I'm going to share a couple with you today. You can bend your knees. Let your knees fall together as you bring your feet a little further out from your hips, closer to the edges of the mat. That's option one. Another option I'm going to give you today is to place the pillows or the blankets underneath your knees and then rest your back of your knees on the pillow. So take this few moments now to find the posture, the Shavasana posture, that you can completely relax. If you find your mind already starting to wander into what you have to do next, try to bring your focus and your attention back to your breath. Allow yourself just a couple more minutes from doing to just being. Feel the energy of all these postures that you just did running through your body. You are welcome to stay in Shavasana for as long as you like. The beauty of practicing at home. If you're ready to come out of the posture and start your day, begin with just gentle movements. Your fingertips, your toes wiggling, moving your wrists and your ankles around. Removing any props that you might have, and if you've bent your knees, then try to straighten it just for the last few minutes. moving into a fetal position, bringing the knees in, rolling onto your favorite side, cradling your head in your arm supporting that head and neck. Try to keep your eyes closed. Pressing into the top hand as you lift yourself up. Very slowly, no rush. Once again, trying to keep your eyes cast downward or into a nice, soft close of the eyes. Place your hands on top of your thighs with the palms either face down or face up. Coming back to our pose that we started with, the Sukhasana, the easy seated pose with the eyes closed. On your next inhale, begin to gently blink your eyes open. Thank you for joining me today. I hope you found this practice nourishing and exactly what you needed for today. I hope to see you next time. Thank you.